Regaining muscular strength, endurance, and power. Sensory receptors provide input to the central nervous system and can influence the neuromuscular system. Various sensory receptors on the skin, including the free nerve endings that perceive pain and temperature, the myocinial corpuscles that receive light touch sensation, and the pacinian corpuscles that perceive pressure sensation, all transmit afferent impulses to the central nervous system. Once these signals are received and interpreted by the central nervous system, a response is transmitted down the spinal cord through the spinal pathway to the anterior horn, along efferent nerves to the motor structure in the muscle that responds to the impulses that they receive. When an impulse is strong enough to produce an action potential, the motor neuron fires and all of the fibers that it supplies respond. This response is called the all or none principle. As a rule, the more motor units are facilitated to fire at one time, the stronger the muscle's response. The wall of a nerve or muscle cell membrane has a resting potential. When an excitation impulse occurs, a change in the electrical charge along the cell membrane occurs and produces an action potential. The membrane potential goes from negative to positive and quickly returns to negative once the impulse has passed. The action potential sequence. The action potential is released to trigger nerve responses at motor end plates. The release of acetylcholine at motor end plate initiates the muscle response. Calcium ions are released from sarcoplasmic reticulum. Calcium ions bind to troponin to slide tropomyosin away from actin binding sites. The extended myosin heads attach to actin's binding sites, creating cross bridges between the actin and myosin. Myosin contact with actin causes hydrolysis of ATP to ADP and phosphate, producing energy. ADP releases from myosin heads, creating the power stroke as the myosin heads move back to their uncocked positions while still attached to the actin binding sites. New ATP attaches to myosin, detaching myosin from the actin binding sites. Calcium releases from the troponin and re-enters sarcoplasmic reticulum. Tropomyosin covers the actin's binding sites, and the sarcomere returns to pre-activity conditions. Skeletal muscle's physiological characteristics are unique to skeletal muscle and are vital for normal functions of the muscle. Irritability of the motor unit determines the amount of stimulation required to initiate the response of a muscle fiber. In order to cause a response, a minimum amount of stimulation, called a threshold stimulation, is necessary. A sub-threshold stimulation will cause no muscle activity. If the stimulus is above the threshold level, the reaction is greater because either more motor units respond or the duration of the discharge of impulses along one motor unit is increased. Contractility. After depolarization, the mechanical response is the contraction. In a muscle fiber, it is a simple twitch response. One twitch contraction occurs for each stimulus. Viscosity is the internal resistance that limits the rate of muscle contraction. The general rule of viscosity applied to muscle activity is that the faster the rate of muscle contraction, the greater the internal resistance and the less external force that can be exerted by the muscle. At faster speeds, more force is required to lift the same weight. Extensibility and elasticity. A muscle's individual fiber follows Hooke's law. The stress applied to stretch a body is proportional to the strain or the change in length that is produced as long as the elasticity limit of the body is not exceeded. The fiber is elastic, and when a stretch is applied, there is some return to the fiber's original length. But because the fiber also contains plastic elements, there is some change in length if the force applied is sufficient of magnitude and duration. As a muscle is stretched, it becomes more extensible. It becomes more extensible because its connective tissue is heated and stretched within the activity. Stiffness, all tissue and structures have stiffness. Stiffness is the resistance of the tissue or a structure to deformation or change in shape and length. If the tissue is stretched quickly, the tissue's stiffness or resistance to change is greater than if it is stretched slowly. The greater the tissue stiffness, the more force it will take to change the tissue's length. Contracture is a failure of relaxation of a muscle. Relaxation is the normal metabolic process of a muscle following contraction. Contracture is one reason for the importance of stretching after exercise. As the muscle fatigues with activity, the fibers shorten and do not resume their normal resting length. Contracture is also the reason why a patient should perform more strenuous and more demanding therapeutic exercises earlier in the day's rehabilitation session. As the patient fatigues, the muscle fiber's resting length decreases. The muscle's ability to perform an activity correctly becomes limited, and so the risk of injury increases. Fatigue. The property of fatigue is closely related to contracture. Fatigue can result either from exhaustion of a muscle with prolonged activity or from failure of the circulatory system to provide necessary nutrients to continue muscle activity. One agent responsible for local muscle fatigue is lactic acid, which is a byproduct of muscle activity. It also serves as a measure of exercise intensity. Tetany versus tetanus. If a series of stimuli is delivered to muscle fibers at a rapid frequency, the muscle fiber produces a tetany, which is a sustained muscle contraction. While tetany is a sustained muscle contraction, tetanus is an intermittent contraction noted by a tremor. Following musculoskeletal injuries, there will be some degree of impairment in the muscular strength and endurance. Improving levels of strength and endurance are critical to return the individual to activity or sports performance following injury. By definition, muscular strength is the ability of a muscle to generate force against some resistance. Maintenance of at least a normal level of strength in each muscle or muscle group is important for normal, healthy living. Muscle weakness or imbalance can result in abnormal movement or gait and can impair normal functional movement. Resistance training plays an important role in rehabilitation recovery. Muscular strength is closely associated with muscular endurance. Muscular endurance is the ability to perform repetitive muscular contractions against some resistance for an extended period. As muscular strength increases, there tends to be a corresponding increase in endurance. For the average person, developing muscular endurance is more likely important than developing muscular strength, because muscular endurance is probably more critical in carrying out everyday activities of daily living. This statement becomes increasingly true with age. Skeletal muscle is capable of 3 different types of contraction: isometric contraction, concentric contraction, and eccentric contraction. An isometric contraction occurs when the muscle contracts to produce tension, but there is no change in muscle length. Considerable force can be generated against some immovable resistance, even though no movement occurs. In a concentric contraction, the muscle shortens in length, while tension increases to overcome or move some resistance. In an eccentric contraction, the resistance is greater than the muscular force being produced, and the muscle lengthens while producing tension. Concentric and eccentric contractions are considered dynamic movements. A conocentric contraction combines both a controlled concentric and a concurrent eccentric contraction of the same muscle over 2 separate joints. An econocentric contraction is possible only in muscles that cross at least 2 joints. An example of an econocentric contraction is a prone, open kinetic hamstring curl. The hamstrings will contract concentrically to flex the knee, while the hip tends to flex eccentrically, lengthening the hamstring muscle group. Strength training must focus on the functioning of muscle. Exercises should always be multiplanar, and should also include various contractions, functionally concentrating on all three types of contractions for each muscle. All fibers in a particular motor unit are either slow twitch or fast twitch fibers. Each kind has distinctive metabolic and contractile capabilities. Slow twitch fibers are also referred to as type 1 or slow oxidative fibers. They are more resistant to fatigue than fast twitch fibers. However, the time required to generate force is much greater in slow twitch fibers. Because they are relatively fatigue resistant, slow twitch fibers are associated primarily with long duration, aerobic type activities. Fast twitch fibers are capable of producing quick, forceful contraction, but have a tendency to fatigue more rapidly than slow twitch fibers. Fast twitch fibers are useful in short-term, high-intensity activities, which mainly involve the anaerobic system. Fast twitch fibers are capable of producing powerful contractions, whereas slow twitch fibers produce a long endurance force. There are two subdivisions of fast twitch fibers. Although both types of fast twitch fibers are capable of rapid contraction, type 2A fibers, or fast oxidative glycolytic fibers, are moderately resistant to fatigue, whereas type 2B fibers, or fast glycolytic fibers, fatigue rapidly and are considered to be true fast twitch fibers. Recently, a third type of fast twitch fibers, type 2X, have been identified in animal models. Type 2X fibers are fatigue resistant and are thought to have maximum power capacity, less than that of type 2B, but greater than that of type 2A fibers. There are several factors that determine the level of muscle strength, endurance, and power. The size of the muscle, the muscular strength is proportional to the cross-sectional diameter of the muscle fibers. The greater the cross-sectional diameter, or the bigger the muscle, the stronger it is, and thus the more force it can generate. The size of the muscle increases in cross-sectional diameter with resistance training. This increase in muscle size is called hypertrophy. A decrease in the size of muscle is referred to as atrophy. The number of muscle fibers. Strength is a function of the number and diameter of muscle fibers composing a given muscle. The number of fibers is an inherited characteristic. A person with a large number of muscle fibers to begin with has the potential to hypertrophy to a much greater degree than does someone with relatively few fibers. Neuromuscular efficiency. Strength is also directly related to the efficiency of the neuromuscular system and the function of the motor unit in producing muscular force. Initial increases in strength during the first 8 to 10 weeks of a resistance training program can be attributed primarily to increased neuromuscular efficiency. Resistance training will increase neuromuscular efficiency. Resistance training will increase neuromuscular efficiency in 3 ways. There is an increase in the number of motor units being recruited, in the firing rate of each motor unit, and in the synchronization of the motor unit firing. Age. The ability to generate muscular force is also related to age. Both men and women can increase strength throughout puberty and into adolescence, reaching a peak around 20 to 25 years of age. This ability then begins to level off and in some cases even declines. After age 25, a person generally loses an average of 1% of their maximal remaining strength each year. By the age of 65, a person would only have about 60% of the strength that they had at age 25. This loss of muscular strength is related to an individual's level of physical activity. People who are more active have a decrease in the decline of muscular strength. Strength training is therefore important for all individuals regardless of their age. Biomechanical considerations. Strength in a given muscle is determined not only by the physical properties of the muscle, but also by biomechanical factors that dictate how much force can be generated through a system of levers to an external object. The position of the tendon attachment. The position of the attachment of a muscle will determine how much force the muscle can generate. Changes in attachment can alter the force generating capabilities. These are genetic, so there is not much room for alterations, but should be considered with surgical interventions where muscles or tendons must be repositioned or repaired. The length-tension relationship. The length of a muscle determines the tension that can be generated. Varying the length of the muscle allows for different tensions to be produced. This is determined by the overlap and interaction of the actin-myosin filaments. If the muscle is shortened or lengthened in extreme ranges of motion, then the interaction between the actin and the myosin myofilaments throughout the cross bridges is greatly reduced, and the muscle is not capable of generating significant tension. Overtraining can have a negative effect on the development of muscular strength. Overtraining is an imbalance between exercise and recovery. The training program exceeds the body's physiological and psychological limits. Overtraining can result in a psychological breakdown, also known as staleness, or a physiological breakdown that involves musculoskeletal injury, fatigue, or sickness. Engaging in proper and efficient resistance training, eating a proper diet, and getting appropriate rest can all minimize the potential negative effects of overtraining. The physiology of strength development. Resistance training improves muscular strength and results in an increased size or hypertrophy of a muscle. So what causes the muscle to hypertrophy? Several theories have been proposed. Some evidence suggests that there is an increase in the number of muscle fibers, or hyperplasia, as a result of fibers splitting in response to training. This research has been conducted in animals and should not be generalized to humans. It is generally accepted that the number of muscle fibers is genetically determined and does not seem to increase with training. It has also been hypothesized that since a muscle is working harder in resistance training, more blood is required to supply the muscle with oxygen and other nutrients. Thus, the number of capillaries increases. This is only partially correct. No new capillaries are formed during resistance training. However, a number of dormant capillaries may become filled with blood to meet this increased demand for blood supply. The third theory, an increase in muscle size, seems to be most credible. Muscle fibers are composed of small protein filaments called myofilaments, which are contractile elements in the muscle. The two myofilaments, actin and myosin, have finger-like projections or cross bridges. When a muscle is stimulated to contract, the cross bridges pull the myofilaments closer together, shortening the muscle and producing the movement at the joint the muscle crosses. These myofilaments increase in size and number as a result of resistance training, causing the individual muscle fibers to increase in cross-sectional diameter. Reversibility. If a resistance training is discontinued or interrupted, the muscle will atrophy, decreasing both in strength and mass. Adaptations in skeletal muscle begin to reverse in as little as 48 hours. Consistent exercise of a muscle is essential to prevent reversal of hypertrophy that occurs from strength training. Other physiological adaptations associated with resistance training include strength of non-contractile structures, including tendons and ligaments, is increased. Increased bone mineral content makes bones stronger and more resistant to fracture. Maximal oxygen uptake is improved when heart rates are at or above training levels. This occurs if resistance and training intensity is high enough to elicit a cardiovascular response or adaptation. These increases are minimal, so if increased maximal oxygen uptake is the goal, aerobic exercise rather than resistance training is recommended. We also see an increase in metabolic enzymes important to enhance aerobic and anaerobic metabolism. There are many different techniques to improve strength. Some of these training protocols include functional strength training. isometric exercise, progressive resistance exercise, isokinetic training, circuit training, plyometric exercise, and calisthenic exercise. Regardless of the specific strength training technique used, it is important to integrate functional strength activities involving multiplanar, eccentric, concentric, and isometric contractions. One basic principle of reconditioning is extremely important. For a muscle to improve in strength, it must be forced to work at a higher level than it is accustomed to, or the muscle must be overloaded. Without an overload, the muscle will be able to maintain strength as long as a training is continued against a resistance to which the muscle is accustomed, but without any additional strength gains. Maintenance of existing levels of muscular strength may be more important in resistance programs that emphasize muscular endurance rather than strength gains. To most effectively build muscular strength, resistive training requires a consistent, increasing effort against progressively increasing resistance. Resistive exercise is based primarily on the principle of overload and progression. If these principles are applied, all of the following resistance training techniques will produce improvement of muscular strength over time. Progressive overload is limited to some degree by the healing process. If an aggressive approach is taken, the rate of progression is best determined by the injured patient's response to a specific exercise. Exacerbation of pain or increased swelling should alert the clinician that the rate of progression is too aggressive. The strength training technique in conditioning or rehabilitation is often focused on isolated single-plane exercises used to elicit muscle hypertrophy in a specific muscle. These exercises have very low neuromuscular demand because they are performed primarily with the rest of the body artificially stabilized on a stable piece of equipment. The central nervous system controls the ability to integrate the proprioceptive function of a number of individual muscles that must act collectively to produce a specific movement pattern that occurs in 3 planes of motion. Then isolated training does little to improve functional ability. When strength training using isolated single-plane, artificially stabilized exercises, the body is not being prepared to deal with the imposed demands of normal daily activities. Functional strength training provides a unique approach that may revolutionize the way the sports medicine community thinks about strength training. To understand the approach to functional strength training, the clinician must understand the concepts of the kinetic chain and must understand that the kinetic chain is an integrated functional unit. The kinetic chain is composed of muscle, tendons, fascia, and ligaments, as well as the articular system and the neural system. If any system within the kinetic chain is not working efficiently, the other systems are forced to adapt and compensate. This can lead to tissue overload, decreased performance, and predictable patterns of injury. Functional strength training uses integrated exercises designed to improve functional movement patterns, not only to increase strength and improve neuromuscular control, but also high levels of stabilization strength and dynamic flexibility. Unlike traditional strength training techniques, which use barbells, dumbbells, or exercise machines, and single planar exercises day after day, a primary principle of functional strength training is to make use of training variation to force consistent neural adaptations instead of concentrating solely on morphological changes. Exercise variables that can be changed include the plane of motion, body position, base of support, upper or lower extremity symmetry, the type of balance modality, and the type of external resistance. Isometric exercise. An isometric exercise involves a muscle contraction in which the length of the muscle remains consistent, while tension develops towards a maximal force against an immovable resistance. An isometric contraction provides stabilization strength that helps to maintain normal length tension and force couple relationships that are critical for normal joint arthrokinematics. Isometric exercises have been demonstrated to increase muscular strength. Strength gains are relatively specific, with as much as 20% overflow to the joint angle at which training is performed. In other angles, the strength curve drops off because of a lack of motor activity at that angle. Strength is increased at a specific angle of execution, but there is no corresponding increase in strength at other positions in the range of motion. Another disadvantage to isometric exercise is that they may produce a spike in systolic blood pressure, potentially resulting in a cardiovascular accident. The sharp increase in systolic blood pressure results from a Valsalva maneuver, which increases interthoracic pressure. To avoid or minimize this effect, it is recommended that breathing be done during the maximal contraction to prevent this increase in pressure. The use of isometrics in rehabilitation is widely practiced, such as when injuries are exacerbated with full range of motion resistance exercises. The use of isometric exercises at multiple joint angles can be employed. Functional isometrics should continue until the healing process allows for full range of motion activities. It is recommended that isometric contractions be held for 10 seconds at a time, at a frequency of 10 or more contractions per hour. Isometric contractions may be used when there is a joint angle referred to as a sticking point. It is not uncommon for there to be one particular angle in the range of motion at which smooth movement is difficult because of insufficient strength. If strength can improve in this joint angle, then a smooth coordinated movement can be performed. Another technique of resistance training is progressive resistance exercises. Progressive resistance exercises uses exercises that strengthen the muscles through a contraction that overcomes some fixed resistance, such as a dumbbell, barbell, various exercise machines, or resistive elastic tubing. Progressive resistive exercises use isotonic or isodynamic contractions, where force is generated while the muscle is changing in length. We can use concentric or eccentric contractions during progressive resistive exercises. It is possible to generate greater amounts of force against resistance with an eccentric contraction than with a concentric contraction, because eccentric contractions require a much lower level of motor unit activity to achieve a force than do concentric activities. Fewer motor units are firing to produce a specific force, so additional motor units can be recruited to generate increased force. Additionally, oxygen use is much lower during eccentric exercise than comparable to concentric exercise. Eccentric contractions are less resistant to fatigue, and the mechanical efficiency of eccentric exercises can be several times higher than concentric exercises. Eccentric contractions are critical for deceleration of limb motion, especially during high-velocity dynamic activities. Strength deficits or an inability of the muscle to tolerate these eccentric forces can predispose an individual to injury. We need to be able to control body movements, and the deceleration in eccentric training helps to develop this control. Free weights versus exercise machines. There are a variety of pieces of equipment that have advantages and disadvantages. The machines are safe, they're easy to use, and they have constraints on motion and generally perform single-plane motions. For free weights, they do not restrict motion and incorporate certain levels of neuromuscular control. We also have surgical tubing or TheraBand. This is widely used in sports medicine and allows for motion in multiple planes. There is an ability to perform more functional movement patterns and can be used with PNF or plyometric activities. There is also variable resistance. This is a change in force required at different angles to move a particular resistance. This is accommodating resistance or variable resistance equipment that changes the resistance at different points in the range. Cams and a pulley system help to alter the resistance throughout the movement pattern. Perhaps the most confusing aspect of a progressive resistance exercise is the terminology used to describe specific programs. Repetition is the number of times a specific movement is repeated. Repetition maximum is the maximum number of repetitions at a given weight. Set, a particular number of repetitions. Intensity, the amount of weight or resistance lifted. Recovery period, the rest interval in between sets. Frequency, the number of times an exercise is done in 1 week's period. There are recommended techniques of resistance training. A considerable amount of research has been done in the area of resistance training, and individuals must consider 4 areas: the amount of weight being used, the number of repetitions, the number of sets, and the frequency of the training. Although there are a variety of recommendations with rehabilitation, the healing process must dictate the problem, and focus on intensity is the key. Resistance training programs were initially designed by powerlifters and bodybuilders. A variety of strength routines exist, such as single sets, which is 1 set of 8 to 12 reps at a slow speed. Trisets, 3 exercises for 1 muscle group with 2 to 4 sets with no rest. Multiple sets, 2 to 3 warm-up sets with progressively increasing resistance, followed by several sets at the same resistance. Supersets, there are multiple exercises, 1 set of 8 to 10 repetitions, or 1 to 2 exercises with multiple sets of 8 to 10 repetitions. Pyramid, multiple sets are decreasing repetitions and increasing resistance. And a split routine, workouts exercise different groups of muscles on different days. The techniques of resistance training utilized in rehabilitation. The Delorme method is based on repetition maximums of 10. The Oxford method is used during early, intermediate, and advanced levels of rehabilitation. This focuses on the percentage of maximum that was reversed in 3 sets. The McQueen technique. This technique uses a varying sets for beginning, intermediate, and advanced levels. The Sanders program. This is utilized in advanced stages of rehabilitation and uses a percent of the individual's body weight. The Knight Daily Adjustive Progressive Resistance Exercise, or DAPRE. This protocol is adjusted based on an individual's progress. We can see the top chart. How an individual performs during set number 3 will determine set number 4 for that individual day, and is known as the adjusted working weight. We use the bottom table, the adjusted working weight table, to calculate set 4 and also our weight for the next exercise session. So for example, during set 3, we have 100% of the 10 rep maximum. The individual lifts as many times as they can. If the individual was only able to lift weight twice, then we would use the 0 to 2 for the number of reps during the 3rd set. The adjusted working weight for the 4th set should be to decrease the weight by 5 to 10 pounds. We also need to look for the next exercise session. For the next exercise session, we will start our weight by reducing the weight by 5 to 10 pounds. The Berger adjustment technique. This adjusts within an individual's limitation. It should allow for 6 to 8 repetitions on 60 to 90 seconds, and the individual must be able to achieve 3 sets of at least 6 rep max and no more than 8 rep max. For this protocol, increases in weight occur in only 10% increments. For rehabilitation, we need to base a program on pain and the healing process. This should be performed daily and early on in the rehabilitation. If training is done properly, using both concentric and eccentric contractions, resistance training is necessary only twice a week. However, this schedule has not been sufficiently documented. Circuit training. This is a group of exercises including flexibility, calisthenic, strength, and brief aerobic exercises. It is used to increase strength or endurance. Circuit training is effective in improving strength and flexibility. Individuals move from one station to the next, performing exercises for a given amount of time period or a number of repetitions. The typical workload might include 8 to 12 stations within the entire circuit, being completed 3 times. There are a variety of machines or manufacturers that are available for isokinetic exercises. This can be used with eccentric or concentric exercise. Isokinetics can also be used as a conditioning tool. In order to gain strength, a maximal effort must be applied by the patient. A dynamometer will move at the set speed whether maximal or half maximal effort is put forth. This means that a patient could potentially cheat with the machine if they're not putting forth a maximal effort. Unfortunately, isokinetic dynamometers are not cost-effective. They're very expensive. We can also use isokinetics in rehabilitation. This gained popularity in rehabilitation during the 1980s. It also provides objective means of athlete or patient evaluation. There are a variety of benefits derived from training at fast and slow speeds. Training at fast speeds results in more generalized increases in torque values at all velocities. At slower speeds, increased neuromuscular efficiency has been demonstrated. Plyometric exercise has also been called reactive neuromuscular training. This is typically incorporated into later stages of the rehabilitation protocol. Plyometric exercises include a rapid stretch of a muscle eccentrically, followed immediately by a rapid concentric contraction of that muscle to facilitate and develop explosive movement over a short period of time. The greater the stretch put on the muscle from the resting length, the greater the resistance the muscle can overcome. The speed of the stretch is emphasized over the magnitude of the stretch. These exercises are used to develop eccentric control in dynamic movements. Plyometrics places a great stress on the musculoskeletal system. The learning and perfection of specific jumping skills and other plyometric exercises must be technically correct and specific to an individual's age, activity, physical, and skill development. Calisthenics or free exercise is one of the more easily available means of developing strength. Isotonic movement exercises can be graded according to intensity by using gravity as an aid, by ruling out gravity, by moving against gravity, or by using the body or a body part as resistance against gravity. The body is often supported, or the whole body is moved against the force of gravity. Calisthenic exercises are used in functional strength training. This needs to be performed throughout the entire range of motion. Some examples of these types of exercises are pull-ups, push-ups, back extensions, and leg extensions. Core stabilization and strengthening. A dynamic core stabilization training program should be a fundamental component of all comprehensive strengthening and injury rehabilitation programs. The core is defined as the lumbopelvic hip complex. The core is where the center of gravity is located and where all movement begins. There are 29 muscles that have their attachment to the lumbopelvic hip complex. A core stabilization program can help to improve dynamic postural control, ensure appropriate muscular balance and joint movement about the core, and improve neuromuscular efficiency and expression of dynamic functional movement. This provides optimal stabilization of the kinetic chain and balanced muscular functioning throughout the chain. A weak core is a fundamental problem of an inefficient movement that leads to potential injury. The concept of kinetic chain deals with the anatomical functional relationship that exists in the upper and lower extremities. An open kinetic chain exists when the foot or the hand is not in contact with the ground or some other surface. In a closed kinetic chain, the foot or hand is weight-bearing. Strength and endurance are closely related. As one improves, the tendency is for the other to do the same. For strength development, in order to increase strength, we want to consider heavier weights and lower repetitions. In order to focus on endurance training, lighter weight and higher repetitions, somewhere around 10 to 15 repetitions, are suggested. The approach to strength training is no different for females than males. However, some obvious physiological differences exist between the genders. The average female will tend not to develop significant muscle bulk due to reduced levels of testosterone. For the average female, developing large, bulky muscles through strength training is unlikely, although muscle tone can be improved. Muscle tone refers to the firmness of the tension of the muscle during a resting state. The initial stage of resistance training programs are likely to produce dramatic increases in strength. Both men and women often see extremely rapid gains in strength when weight training programs are first begun. These gains are likely primarily neuromuscularly driven. In females, these initial strength gains tend to plateau and minimal improvement in muscular strength is realized during a continuing resistance training program. Males tend to continue developing strength throughout increased bulk following the neuromuscular strength gains. There is a strength to body weight ratio. Females tend to have lower ratios due to higher levels of body fat. There is also an absolute strength difference. Strength is reduced when body size and composition are compared. Leg strength can actually be stronger in females, with upper extremity strength greater in males. The same principles can be applied to younger athletes, although there is a large debate regarding the sociological and physiological makeup of these younger adults. If an individual is properly supervised, young athletes can make improvements in all areas of fitness. Prepubescent children will experience gains in muscle strength without muscle hypertrophy. Resistive exercises should be integrated into a younger athlete's rehabilitation. Close instruction and supervision is mandatory and should be based on the extent of the maturation to ensure that proper form and technique have been mastered by the individual. Are specific resistance exercises used in rehabilitation? Remember the goal of the program. Usually, this is to regain and possibly increase specific muscle strength, or to increase the efficiency of muscle movement. There are a variety of exercise modes that can be used to achieve our goals.